Sweet. Thank you, everybody who's here. Today, we've got Alyssa Putman, who is our revenue cycle management expert. She knows a lot more about this than I do, so she'll be running the show today, but we'll be going over some RCM myths and debunking them. As always, like I said before, we do open Q&A, so if you need to ask questions during, feel free to put it in the Q&A in Zoom. We'll also have some time at the end to discuss any questions and answer them. So yeah, looking forward to it. Alyssa, I'll go ahead and turn the time over to you.
All right, awesome. So welcome everybody. Thank you for joining us today for our RCM Myths Debunked. I'm Alyssa Putman. As Sean introduced me, I'm the Director of Revenue Cycle for BH Rev. I work alongside behavioral health and SUD treatment providers every day to help simplify their billing, reduce denials, and strengthen overall financial operations. I'm also a member of the Opus RCM team. So when you hear BH Rev, don't be confused. We're just all under the same umbrella. We're just our own department. So kind of so we can separate and organize the software side versus the services side. So we're all on the same team working to best help everybody. But diving into it today, if you've ever felt overwhelmed by the billing process, unsure of what's actually required to get paid, frustrated by reoccurring denials, trust me, you're not alone. Everybody has felt that. So revenue cycle is one of the most misunderstood pieces of the behavioral health operations. So today we're going to clear some things up, bust through some of the common myths and highlight what's true and give you some practical insights that can make you can take back to your team, whether you manage billing in-house, outsource it, or somewhere in between there. So in behavioral health, we know that revenue cycle management is, like I said, often really misunderstood. Oftentimes we find that it's under prioritized or even overly complicated because of complex player rules, changing regulations. So when that happens, the result typically is the missed revenue piece. We have compliance risk and unnecessary stress, especially if we have an insurance payer like Medicaid that decides they want to do an unannounced visit, and then all of a sudden we're panicking looking at the revenue cycle piece. So today we're going to work to clear that fog. We're going to bust through some of the common myths, show you what strong RCM actually looks like, and that way you can just stop getting by if you're feeling like you're in that rut of getting by and start getting paid accurately, on time, and with confidence. So our goal today is simple. We're going to cut through the confusion and help you gain the clarity, control, and confidence in your revenue cycle so that you can reclaim the control that you're looking for. Just a little background on our company, as I already had mentioned, that we're behavioral health revenue is a full service revenue cycle solution. Our purpose is solution we're built for behavioral health and substance abuse treatment providers specifically. Like I said, we operate under the same parent company as Opus. We're just two divisions working together as one unified team that overall can support your success. So we don't have to manage and be the middleman, so we can outsource and get you information. Opus doesn't say, oh, what happened on the software side? We got to contact somebody in a completely different company. We're all together in the divisions that are working for you guys. This means that our partners, which would be you, can benefit from seamless coordination, the integrated tools we all offer, and really an overall shared experience. We're really just here to simplify your EHR and revenue cycle and help your organization to thrive. All right, so let's get into the nitty-gritty of everything today for the webinar, talking really into the myths of the revenue cycle. But in order to understand that, we need to make sure that everybody knows what the revenue cycle is. This is our entire financial process. So a lot of people think of revenue cycle as just the submission of the claims, but essentially, revenue cycle starts from the time you scheduled an appointment and clear through the intake process, the documentation process, billing and claims submission, payment posting, collections. All of that rolls up into the revenue cycle management piece. So if you have an issue in one part, saying your intake and scheduling piece, you're not getting the right benefits verified, that's going to do an entire impact to your billing and claims process and impact the overall revenue cycle. So that's why it's important to have a strong financial sustainability for your agency and make sure that you have a strong revenue cycle and management process in place. So let's get into some of the problems that we face. So one of the first problems is that A lot of people are sold on the fact that billing software alone is enough. When in reality, we know that software helps, but human oversight to clean data, look at data, no payer specific knowledge is still essential. That's one of the great things about our partnership with us is that you get both the Opus RCM platform combined with the BH services. So you get a AI powered automation with expert human oversight to ensure that your claims are submitted accurately and we have humans that are doing proactive problem solving in addition to the software. A lot of agencies get sold on the idea that, hey, we have this software, it's going to do everything for you, and are made to believe, hey, you just submit your bill into it and everything's going to go through a clearinghouse and be great after that. When in reality, they don't do the prior authorizations. They don't go in and do the denial management piece and write your appeal letters and make sure that you're reviewing and being proactive on if your contracts are paying enough. So that's where you can combine the AI piece or the software piece with the human interaction that really fully engages and maximizes your revenue piece.
I love that, Alyssa. I think as well, like you mentioned, just having the software isn't enough. There is still that human component, but with having an RCM services provider, it's like we can take care of that for you too.
Absolutely. And that's a key piece for a lot of agencies today. It's like, oh, I paid all this money invested in this software and I'm still getting denials. What's going on? And without a dedicated team to be able to go in there and deep dive, they're definitely not maximizing the ability of the software that's in place. It can only take you so far. And then the human component has to take it to the end of the finish line.
Absolutely. I actually just spoke yesterday with someone on our podcast, and they were talking about how so many tools are just underutilized. You're paying for the software and you're not utilizing it as to its full potential. There's all the training you can do in the world, but really understanding the revenue cycle is super important.
Absolutely. And I go have that conversation with people all the time that will be going through, will be looking at what software offers, and I'll get oh, I had no idea it could even do that. So when you have that piece and you have that human expertise that can go in, do that training, but then be that back end and say, hey, you're not clicking this one button, or hey, did you know you could run this one report? And all of a sudden people really start to see, hey, we can maximize and we can use this to our full advantage. And that's when you really start to see you capitalize on everything from the EHR system clear through the whole RCM platform and the whole RCM cycle.
Yeah, absolutely.
And that kind of takes us into looking at another myth where people are like, oh, credentialing isn't part of the RCM concern, because a lot of people just have that thought that, oh, well, if we are talking about RCM, it's just the claims and we submit the claims out. But on the back end, if you're not properly credentialed and enrolled with a payer before you submit that claim, there's a good chance you're going to get denied and you're not going to recoup the money for those services. So that's another key piece of what we can do, and where platform alone isn't able to just help you. We can manage that end-to-end credentialing and payer enrollment for all the providers in an agency. That way agencies are fully billable and all the services are fully billable from day one once we get started. I've worked with agencies that are like, hey, I submitted a bill to CareSource and I'm getting a denial, only to find out that they're not credentialed and enrolled with CareSource as a payer. And it go back and have that conversation. It's like, well, I entered it into the software and I thought that meant I was enrolled. And it's like, oh no, there's a whole lot of other steps that go into it. And again, a lot of people just don't understand how credentialing rolls into the RCM cycle, but everybody wants to be paid. So making sure you're properly enrolled with the insurance providers is a really big piece of this. And it doesn't mean everybody's got to be enrolled with every insurance provider, anywhere from just like 3 to 5 insurance providers are what we see. But what we can also do on the RCM side is be proactive and take a look at, hey, you got 10 clients that reached out to try and start services with you that had UHC as an insurance. Maybe we need to look at actually credentialing with them because we're missing out on that piece. And the software alone isn't able to tell you that. So that's, again, another piece of why having a good, solid RCM service cycle in place is really beneficial to an agency.
Absolutely. I love that you mentioned like we always have those blind spots of things that we're missing out on, especially from a revenue perspective. And it's super important to have technology that works for you and somebody to help you make sure you're not missing anything, right?
Absolutely. Absolutely. And that's again, it's just one of those things that we're so focused, and I've sat in the same seat as many of the people on our webinar today of providing the administrative and clinical services. And we get so focused on that quality of care that we kind of forget some of those back end details. And that's where, again, having a good strong service provider can come in and manage those for you so you can keep focusing on that high end quality of care.
That, that.
And that's where we get into our myth number 3. So a lot of people just think like, you know what, denials are going to be inevitable. We're going to get them. And to an extent, that's true. But what people don't realize is that a lot of denials are actually very preventable. It just requires going through the software and making sure that we're being proactive. We have the appropriate verification document in place and that the claims are being reviewed. So software again can run through and say, hey, do we have X, Y, and Z in place before we submit it through the clearinghouse? Great, can submit it. But then once it gets into the lap of the insurance agency, they might take a look at it and say, we don't think that that is actually working. We're going to go ahead and deny that because as we all know, working in the field, insurance companies don't want to pay for the service if they don't have to. So they're looking for reasons to deny. And that's where, again, having a strong service provider in addition to having that RCM software, as we talked, the software alone won't capture all of these things, but we're able to take a look at saying, hey, these past 10 denials all had this same key feature that they were missing a timestamp. And we go in and find out, oh, here's why somebody's not ending, and adding a timestamp, and it's one clinician. So we're able to be proactive and say, hey, let's prevent these denials from occurring. And here's the trends that we're seeing. And that way we start to work in an environment that we don't anticipate that denials are inevitable. It's one of those that when a denial comes through, it's like, oh, this is a rarity. Let's take a deep dive into this. On the other end of that, a lot of agencies get into an issue that, hey, we have these denials. It has to be responded to within 7 days, but we have 1,000 other fires that we have to put it out into our day-to-day operation. Once we sit down and get ready to write that denial appeal letter, the time is already passed and we can still submit it, but it's likely we're going to get another denial. With having a full scale service provider in place, we can write those denials and submit them for you and take that again off of the agency's lap and out of their hands. So it's one less administrative task that they have to worry about.
It's awesome. It's awesome. I think what you were talking about as well is a lot of data visibility. Like once these come up, it's such a rarity. It allows you to like look into your entire process and make sure you're not missing anything.
Absolutely. And that goes right back into, oh, we didn't know the software was capable of doing this. And we can start to run reports and we can start to track and trend different pieces. And that's where it really goes back into, hey, yes, the software can do some of this, but it can't do all of this. So where can we help you to maximize the use of your software, but then bring that human component in so that we, again, are maximizing and making sure you're not having any services that are denied. So it's really a great feature having that piece in place to have somebody that's looking at this for you and submitting those appeals. Because again, I know that I like if somebody's going to take some work off my plate, by all
Yep.
means, go ahead and take it away. And I think most people feel that way this day and age.
Absolutely. It's like regardless of how intuitive the software is, like you got to have somebody who knows the revenue cycle in regards to behavioral health, substance abuse, etc. Like somebody who knows the ins and outs.
Absolutely. And again, that's where we kind of get into trouble as behavioral health providers is we are so focused. And the majority of providers that I work with, it's like, hey, I got into this because, it impacted me personally, or I just want to be able to give back to my community. And those are all great reasons. And that's why I tell everybody, you focus on that and offload that RCM piece that you're not as aware of and you kind of struggle with understanding because it's not your strength. Let us take that over for you. And again, that way you can focus on giving back to your community, providing that high quality of care, and also maximizing your revenue. And I get people are like, well, I'm a little worried that employees are going to come back or people are going to say it's just about the money. And I have to go back and tell everybody, you have to pay the bills to keep the light on to provide the services. So money it has to generate to make sure you can keep providing the quality of services and keep giving back to your community. So let us handle those pieces for you. And a lot of people, that's kind of a deep breath and a sigh of relief once they realize everything that can be offered.
Love that. Love that. Tabitha, to answer your question, absolutely. We will be sending the reporting out. Once it's finished processing, I will put it out for us and send it in an email. So
Perfect. All right. So that gets us into, and again, we kind of are hitting over all of these myths as we're going on and touching on them. But one of our myths, myth number 4, is that all billing partners are the same. And that's just one piece that a lot of people think, oh, I can just choose any billing company out there. It's just outsourcing the work. I'll just go with the cheapest option that's available. Again, I've sat in the seat. I understand, we're always looking where we can, pinch pennies. But the problem that comes down to is that different partnerships vary in expertise, tools, and follow through. And what you'll find is that some actually end up doing more harm than good. I worked with a client a few months back that had the issue that their billing partner that they were outsourcing for was actually miscoding their documentation in an effort to try and generate some additional funds coming in. And that way, ultimately that billing partner, when we looked at the contract, was getting reimbursed more. So there were a lot of concerns, compliance concerns that came from that. And are all billing partners going to do things like that? Absolutely not. But it just goes to show you really need to do your research and making sure you're getting the full capabilities out of your partnership. And also, with that agency, if they didn't have somebody with a set of eyes on that within their agency, and because there wasn't a good reporting process, there wasn't good communication, they may have gone years without realizing that this was in place. So having a partner that's transparent, that's committed to having, routine meetings with you, walking through the data, showing what you're billing, showing those different codes that we're using and what codes are we using most and what modifiers are we using. That way, again, there's a lot of transparency and you're still involved at the agency level for all the day-to-day pieces, but we give you all that feedback of saying, here's what we're doing, here's what, we can maximize, here's where we need some improvements, and really remain a part of your everyday operations with you and always being available to answer any questions that you have. Again, I worked with some billing partners that you will call them and call them and call them because you need a report and it feels like you're getting ghosted and nobody's responding. And 2 weeks later, they finally follow up with you. Again, it's just kind of things to be asking when you're looking for your billing partner. If I have a question, how quick will you get back to me? How do I get a hold of you? Are you going to be my primary contact, or am I going to get outsourced to somebody that then has to wait 3 days to connect me with you? Just great questions to ask because, again, everything is not one size fits all when we talk about billing partners. Getting into myth 5, going right into it, saying you don't need reports if you're getting paid. If I could had $1 for every time I heard somebody say this, that I just don't have time to print those reports, I don't know how to access those reports, the money's coming in, so things are fine. That's when we start to look at, there's no need, that you're not even looking to see if you're having revenue denied. You're not looking to see if there's cash flows delayed. Yes, you might be getting paid, but if your payment is 90 plus days, your AR is accruing, then that cash flow is not coming in at the rate that it should be. And you might be missing compliance issues that you wouldn't see otherwise without those reports. So that's where we kick back to. It's really important to have a good billing partner that's going to say, hey, in the beginning, we're going to meet weekly or monthly. And then, once we have everything set up, maybe we can have quarterly meetings, but we will provide the reports. We're going to walk you through the reports and we're going to answer any questions that you have, but also ask questions of you to make sure, again, that we're maximizing all of your revenue opportunity. And so that's where it's one of those things that don't get caught up in that the reports aren't necessary, because I get it day to day when, sometimes the hours escape us and the next thing you know, it's been 3 weeks and you haven't looked at a single report. That's one piece that we need to make sure that just because you're getting paid doesn't mean you don't need to be looking at the data.
absolutely. Once again, it's the blind spot thing, like you said, having somebody on your side just to be able to make sure you're not missing anything. If things are going well, it's like we still might be missing things. We want to make sure that we're not missing out on any revenue, any patients, etc., so that you guys can focus on your patient outcomes.
And that's where I tell everybody, when you have a partnership, whether it's with us through BH Rev and Opus, or if it's a different partnership, one of the things you should always look at them as is they're just another director that you're overseeing. So you need to be seeing reports from them. You need to be holding them accountable. So those are different pieces to say, if you need a report or you want some additional information, hey, we're going to get that over to you. And you need to make sure that, people are working for you so that we're maximizing everything. But again, don't just shove those reports off to the side just because you're getting paid. That's where we get into our myth number 6 is that, AI, it's a key feature of everything. Everybody's talking about it. It's a hot topic. And so people start to think that AI will fix all our bad billing processes. And as much as I think maybe someday that will be accurate, AI only works based on whatever foundation you build it on. So if your workflows are broken, your AI automation is going to result in chaos and additional chaos, because the AI is only going to work off of the knowledge you give it and off of your current workflows. So one of the things that, again, we go back to is that your software, your AI platforms, they're great. They're very intuitive, but we need to make sure you also have somebody that's on your side that's making sure your workflows are accurate, to make sure they're maximized, and to make sure they aren't broken or flawed that are going to result in issues with the whole billing cycles. So again, AI, as much as we want it to, it doesn't quite fix everything quite yet. Then we get into our insurance. So we kind of touched on this earlier, that you don't need to verify benefits if the client has Medicaid. We just assume, again, a lot of agencies, especially SUD providers, community behavioral health providers, a lot of the clients that they're serving are Medicaid clients. So one thing, though, that a lot of states have started to push are the managed care organizations, but I still work with agencies. They're like, well, we know they have Medicaid. We don't need to verify those benefits. We did it 2 years ago. They still have Medicaid. And it's like, wait a second. You don't know if they've added managed care, supplemental type of insurance in place. So we need to still verify your insurance coverage, because again, we just assume and base that assumption that they have the active coverage, and they don't, then all of a sudden we've got a problem on our hands and we're not going to get paid. So the great thing about working with, again, a platform and that human component is we can enter the data into the software. The software is going to kick back. Yes, they have coverage. No, they don't have coverage. But then what we can do on the human component is contact and reach out to the insurance agency, get the full verification of benefits. How many days are they approved? What's the total allotment? All that different information, and identify, hey, does this person need a prior authorization? Because that's mistake number 2 that we run into, is that agencies will just assume that because you have active insurance will cover it. And they don't realize that sometimes you have to get prior approval from the insurance agency before you start services. So that's a great thing we want to look for in a partner, is just making sure that you can perform real-time eligibility checks and benefit checks for all clients. That way you can avoid that costly assumption that you're going to get paid and then ultimately be served with a denial or a rejection letter. That's where we get into, as long as services are provided, you'll get paid eventually. I have talked about this with so many different agencies. Insurance companies do not want to pay you if they do not have to. So just because you are providing the services, and you could be providing the best services that are known to man, and yet if you don't have the appropriate processes set up, you're likely not going to get paid. So that's again where we go back to the importance of both software with the services side, is that we want to make sure that claims are submitted accurately, on time, and followed through until that final payment is received. And that's where people were like, well, as long as I get paid, but I also intervene and say, well, how much does your contract say you're going to get reimbursed? If your contract says you're going to get reimbursed $150 for the service and you're only getting reimbursed $100, we need to go back to the insurance company and say, you're not meeting the agreed upon amount, and here's what we need to do. So again, that's why it's just important to have that full service cycle in place, and not just bank on, hey, we're providing the services, we're eventually going to get paid, and whatever amount we get paid is good enough. You're not maximizing the ability of your RCM cycle at that point in time.
Yeah, without, somebody to watch those blind spots, it's kind of just wishful thinking, you trust, hopefully I'll get paid, but
I It's like looking at if you're a paid employee. You're not, if your employer tells you they're going to pay you $1,000 a pay period and you only get paid $500, you're going to go back and you're going to complain to them. Same principle works here. You want to make sure that the insurance companies are paying you the agreed amount, but if you don't have somebody looking at that on a day-to-day basis, then you're likely going to be missing some funding that could be coming in. And if that goes on for months or years, you're likely not going to be able to back claim those amounts after a certain period of time.
Absolutely.
And again, that's where we go. We talked about denials earlier, but it's like, oh, those denials, they're just a billing issue. They don't have any clinical background. And unfortunately, that's just not the case because poor documentation can lead to denials, or poor documentation means that we might not be able to have the right information to appeal that denial. So it's really important that both the billing and clinical teams work in sync with one another. So that's one of the great things about having a knowledgeable service provider is that we can work with you to offer documentation guidance and clinician education. That way we can reduce those denials and improve that claim integrity. And that's one of the things that are talked about during those initial, meetings as we're doing onboarding meetings. And once we get rolling, we can do monthly or quarterly meetings that we can come back and say, hey, we've reduced the number of denials, but the denials we do have, we're not getting documentation, and we need this documentation to make sure we get that through for the insurance company, or this is required and we're not seeing it. So really, we can just help you with your overall clinical compliance in addition to the billing piece. I think that gets us back into when we all have talked about, working in silos. It's really about breaking that piece that we're all interconnected in the agency. And again, if we have a poor workflow in one department, it may impact the functionality of the other departments.
I think in conjunction with that, I talk to a lot of behavioral health providers who complain about not only working in silos, but that their systems are siloed. So it's so important that your systems speak to each other, that of course you're speaking to each other. That way everything's working cohesively.
That is one of the awesome things about the new RCM platform that we're offering through Opus is that it speaks directly with the EHR system. So when you add something into the EHR side, it's going to speak over into the RCM side, and no more of that downloading a CSV file or transferring data from one to the next. It's all communicating with one another, and we're monitoring that communication for you, so you don't have to worry about, oh my goodness, what's, are the system speaking or downloading data from one to upload to another. So I see we had a question come in on the Q&A. Says most of what we struggle with is denial of prior auth for a particular level of care, RTC in our instance. Can you talk a little bit about how to increase the odds of getting an initial auth in place? That's a great question, and it's one that a lot of people do struggle with, is that we don't understand how to get that prior authorization. So one of the things that we can work with is breaking down, looking at your insurance contracts and saying, okay, this level of care needs a prior auth, and what information do we need to have in place before we call that insurance agency and get that prior authorization from them. That way, when we call to get that off, we have everything already in place that's needed, so we know we're going to get that authorization approved. But you don't know if a prior auth is needed unless you do a full verification of benefits. And so it's more than just saying, hey, they have active benefits. It's one of those pieces that you're contacting the insurance agency, whether it's through an electronic means such as like an Availity app, or utilizing an RCM service provider such as us with BHREV, that we're reaching out and contacting that insurance agency on your behalf and saying, hey, what level of cares is offer or going to get reimbursed? And then are there any prior authorization requirements? At that point in time, we know right then and there, does it require prior auth or not? On the second end of that, because it might be one thing to get prior authorization, but then if we're not staying up on when the reauthorizations are due, we might get covered for the first 3 to 5 days of services. But then we might have everything after that denied. So it's really important to have people that are staying up to date on your reauthorization piece as well. And that's where we can offer a full utilization review cycle. And that really kind of kicks us back to, why it's important to understand the RCM partnership you're engaging in, because some software will be able to tell you, yes, they have active coverage, or no, they don't have active coverage, but that's it. That's the bare minimum of what it can tell you. So having the right partner will then make sure you have the answer of, yes, they have active coverage and this level of care needs to have a prior authorization, and here's what we need to get that. And then on our end, we submit that prior authorization for you, and then we manage those reauthorizations so you're not worried about staying on top of those from the day-to-day standpoint. If that didn't fully answer the question, I know that was really long and drawn out because the UR process, it can get really complicated, so I'm sorry. But if you have any other questions, just kick it back into that Q&A, and I'm more than happy to answer, or dive a little deeper into anything else you have with that question.
And as well, if you have any questions afterwards, I'll include Alyssa's email in the recording email that I sent. So feel free to reach out to Alyssa after the meeting too.
Absolutely, because I can answer any questions through email, or we can even schedule a time to meet further so we can kind of dive deeper into what issues you're seeing, and how maybe we can help. And that's where, outsourcing billing means I don't need to understand any of it. And so I know sometimes I can get a little long-winded when I try to give details, but that just indicates the complexity of the entire RCM cycle. So that's one thing, is even though you outsource the billing and offload it to somebody that's knowledgeable and an expert in that field, you still need to be able to have insight into the performance risk and the trends that are you're seeing. So addressing the question that we just had, if you're seeing issues with your denials being because of the prior authorizations, that's where our reporting would need to focus. And that's where during our onboarding calls, we would talk about, where are you seeing your largest areas of denials? And we're going to set up systems in place. So we're preventing that issue of having denials because of your prior authorizations. And again, setting up those workflows so we can eliminate an issue like that, and minimize how often you're seeing denials from that. So that's where we really take a look at, what are your current workflows? But that's where, as a leadership team, and managers of different agencies, you still have to be able to say, all right, these trends aren't looking right, or these issues seem like they're putting at risk. Can you explain further? So while you don't need to be an expert in it, it's still good to understand and ask as many questions. I tell everybody that, don't be afraid to ask your RCM partner questions. Just because you're outsourcing it doesn't mean that you just have to sit back and accept what they're telling you. Ask questions. That's how you're going to learn more. And that's how your RCM partner is actually going to learn more about you as well, because they're going to get an idea of where your weaknesses are as an agency as far as the RCM process. So we can really help gear in and tune in to help you make those a strength. And so ask questions, ask questions, ask questions. There are never too many questions to ask of your RCM partner. That's what they're there for. So we've addressed the myths, and so I'm going to get a little into how the product that we offer. And this kind of goes back into things that you should be looking for when you're looking at your different RCM partnerships, or avenues you're looking to explore. That if it's one of those things that, hey, I've got an idea of what some other services can offer, what do you offer? Do you offer anything similar to this? So like I talked about with behavioral health revenue, we're fully and seamlessly integrated with Opus EHR. So we're really your all-in-one RCM solution. We have the performance behind it of being an AI plus that human expertise. So it's more than just submitting those claims like we talked about. It's having the right infrastructure in place, the right tools, the right workflows, the right people. Our power comes from having a combination of integrated technology, automation, that works with a team that knows this space inside and out. So that's where we get into, if we're seeing denials because prior authorizations are missing, we're going to take a look at that workflow and see what we can do to improve that. When we're able to combine all of those pieces together, then we're left with a proactive denial prevention. We have credentialing support, real-time reporting, client first communication, and you're able to rely on some consistent and reliable results. That way you're going to collect more faster and with a lot fewer headaches, because I know the RCM process gives a lot of people headaches. Not everybody gets as excited about talking about the stuff that I do. And a lot of people almost makes them sick to their stomach when they have to start diving into the RCM piece. So we like to do all of that piece for you. But that's where a lot of people say, all right, what does the platform actually do? And so you can see that our functionality of our platform does the eligibility verification. So it's checking for active coverage. A lot of platforms are going to do this to you. And this is where I think a lot of agencies get caught up in, hey, we got the eligibility verification. The software said that they have active coverage, but it ends there. It doesn't go that step further and able to identify, does this service require prior authorization? So again, that's kind of a limitation of all software versus having that software and service engagement both. So it's going to generate or claim generation submission. It's going to scrub through the claims to make sure that all of the payer specific rules are in place to reduce those denials. Do the ERA posting. It's going to generate statements. We can set it up so it will auto post statements. We've got the reporting dashboard. So a lot of the things you'd expect to see in the software, and which are all extremely great features. So I like to tell everybody the software should handle your easy claims. Let it do the easy work, the mindless work, the work that doesn't need to have any of that additional thinking. But the complex claims and the complex pieces of the RCM cycle are where the BH Rev team comes into place. So that's where we look at that eligibility oversight. We ensure that the verifications are correct. We review any failed verifications, we flag any documentation issues, and we're going to call to make sure or reach out to the insurance agencies to make sure that we know if there's any prior authorizations or authorization requirements in place. We'll do the coding and documentation review when we start to get some complex claims that have a lot of additional modifiers or different pieces or add-ons. Then all of a sudden the system gets a little overwhelmed by that. So they might, and any system that you use is not going to be foolproof. So this is where to have that human component to come in, look for missing modifiers, flag any communication issues. It's where that human component still does make an impact. Looking at the denial and appeal management piece, we work denied claims, like I talked about earlier, prepare appeal letters, submit documentation, and we track those outcomes. So we can tell you how successful we are in appealing and overturning those initial denials. And that's where we get into that communication reporting. As I talked about, it's important to be aware of the reports and to look at the reports. So we provide tailored reporting and proactive communication to the agency just to empower your agency to continue to improve. And so kind of getting into what our strategy is, our focus, we believe that RCM should be proactive and not reactive. A lot of agencies will look at reporting and react to what the information is saying versus being proactive from the start of us working for you. So instead of waiting for denials to pile up or revenue to start to take a dip, we take a more strategic approach that focuses on prevention, transparency, and long-term financial health. That means we're going to be building custom workflows around your existing EHR, whether that's Opus EHR and different EHR platform. But we're going to be focusing on those workflows, working with your staff to get everything set up, identifying potential risk early on. So additionally, through conversations and communications, we can identify that you're having issues or concerns with prior authorizations. And that's where we're going to identify what our workflows are going to be to prevent those as right initially in that onboarding piece. So we're addressing that and identifying those risks early on. And then we can take a look at where automation works and then areas where we need to have extra human oversight in place. We really don't take a one size fits all approach. And, I have a lot of people that question that, but I always tell everyone, I've sat in the position that many of you are sitting in. And I always found it interesting that our accrediting bodies tell us everything has to be individualized. Patient care, it has to be individualized. Care plans have to be individualized. Everything has to be individualized. But then when we turn to the RCM piece and we turn to the insurance companies, guess what? They look at all of your documentation through a cookie cutter sort of lens. And So that's where it takes a look at that. Every agency is different. Your workflows are different. How your documentation complete it might be different. So it's not a one size fits all approach. We look at you as an agency and take that background because that's what's important to all of us and was important to us when we worked in positions similar to those that you guys are working in now. Just kind of looking through why we might be the right fit if you're looking or exploring a new RCM provider. We speak behavioral health. So when we say we're the right fit, it's because we built our entire model around behavioral health. We're not trying to take a primary medical care and take that RCM system and just make it work for you. Everything is built around the behavioral health and SUD billing cycle. But the other piece is our team understands the complexity of the payer rules because we've sat in your shoes before. We understand the lingo. We understand if you reach out and you're like, hey, I have to have this report because CARF says or Joint Commission says that I need to review my billing on a quarterly basis to maintain my conformance to compliance. Well, guess what? We're going to get you those reports on that quarterly basis so that you have it all in hand and you're not having to do any additional digging. So we speak behavioral health. We speak the language of not only the insurance agencies, but also the accrediting agencies that you're working with as well. And at the end of the day, that expertise does matter. And it's exactly what allows us to get results faster and with fewer disruptions.
Of that. I think as well, it ties into, we talk about the software and the service and all that. It's important to get something that works for you and not something that kind of works, like we are specifically for behavioral health and substance use. Specifically, Alyssa's been in the space for so long that she knows the in and outs of the industry and the like insurance denials, etc. So
I try to tell people all the time, don't settle for good enough being good enough, especially when it comes to your RCM cycle, because that's what's funding your agency. And we know that there are times when there are worries about, hey, our funding, we're worried about this funding source, we're worried about these grants. That's why we need to make sure we're constantly capitalizing and maximizing what your revenue cycle is because of just that. There could be times that grants you've counted on for years now suddenly go away, and now you have to supplement with more insurance billing. So, again, we speak that language, we know the field, and I think that really helps long term success wise. When we talk about being the right fit as well, we automate it where it matters and we have humans where it counts. So we're not just selling you on the software. That's what a lot of agencies are like, oh, I partnered with X, Y, and Z platform. We use their software. And then when I ask the question, well, do you have somebody that's designated to help walk you through and look at all of this? And it's like, well, no, we have a representative, but they don't really do the reporting or, they aren't looking at all of our reports and they aren't making sure our denials are staying low. It's just the software itself. And that's where I try to tell everybody, RCM is never just like a plug and play when it comes to credentialing, denial resolution, complex payer issues, strategic decision making. You need a real person who understands the nuances of the industry and knows how to advocate for your agency. So a software platform on its own can't be your advocate against an insurance agency if you're getting underpaid or receiving a lot of denials. And that's where having a human component really counts. So we're talking about we're transparent, predictable, and scalable. So we offer flat percentage pricing, real-time dashboards, built-in compliance monitoring. So whether you're a small clinic just starting out or a multi-site agency, we can scale with you without any surprises. So right from the get-go, you'll have upfront cost and pricing that says, as you grow, here's how these rates will grow. That helps you as you're budgeting and you're planning for the future, not have to be worried about how things may change or say, oh, we were only set up as a small clinic and now we've grown and we're medium size and we're now bringing in 500,000 a month in revenue. And how does that impact us in having to renegotiate a contract? Everything's laid out and it's very transparent. There's not going to be any a mystery in our invoices. Oh, I clicked through right there fast. So it makes it nice that you have the option that you can scale and grow. Some agencies want to remain small agencies, and there is nothing wrong with that. But for those agencies that are starting out and they want to continue to grow, we're able to scale our services with you. We're the right fit because your mission ultimately is our mission. Because at the end of the day, what drives us is the same thing that drives you, helping people get the care that they need. So we understand how critical behavioral health and substance abuse treatment services are. We've worked in the field, so we know how hard your team works to deliver that care. So our job is to make sure that your billing and reimbursement doesn't stand in the way of your mission of providing that high quality of care. So when you partner with us, you're not just hiring a billing team or getting a billing software. You're gaining a team that believes in your mission and is committed to protecting your sustainability so you can continue changing lives every single day. I've worked in the field. I always tell everybody you have to get me off my soapbox when we start talking about behavioral health and SUD, because it's a field that I'm so passionate about, and have worked in. And one of the things when I made a move was because I wanted to be able to help as many agencies as I possibly could continue to grow and scale and extend their reach. And one of the things that always stood in the way from agencies I was working with was their billing piece and not understanding how that billing piece worked, or partnering with an agency that didn't share their mission. So when you partner with us, your mission is also our mission. And so with that, thanks for joining us today. I really hope this helps cut through your confusion, clarify some of the myths, and identify how your agency can make your revenue cycle work better for you and not against you. So I'm going to kind of open it up for any questions, some Q&A that anybody might have after we've taken a look at everything. I'm gonna hope the lack of questions just means I did such a thorough and great job of explaining. No, as Sean mentioned earlier, he will send my contact information out with this recording so that you can reach out to me. We can schedule a time to speak more in depth about the unique challenges that you're facing, how we can help prevent those, navigate into some of the myths that you've been told, or dive deeper into some of the myths and create kind of plans of going forward of how we can help, or just some work plans of how you could, better improve some minor things that you're currently working with right now. So you will have my contact information to please reach out at any time you want.
And thank you to everybody who attended the webinar live. Like Alyssa said, I will be sharing the recording, but thanks, Alyssa, for your time and for giving us some more insight into RCM.
Absolutely. Thank you so much for having me.
Of course. Have a good one, everybody.